All right, so hi guys, this is Chad Clark, Physical Therapy Connections. We wanted to show you what we're doing to stay within the CDC guidelines and keep everything safe for you and for everyone that comes in and staff. So as you all know, what's going on in the world for the last 6 weeks, we've actually been fortunate to stay open. We're functioning just about a third of where we were, which is actually a good thing. Well, good and bad, but good because we've learned a lot of things on how we're going to change for the better to serve you in the future and for now. So this was our front entrance. Our physical therapy clinics kind of in the back, which you'll see. You would usually come in here, the Pueblo Athletic Club, their front entrance. Well, they've been closed for the last 6 weeks, so we have an alternative way. So what we'll do is we'll walk around here, and you can park in any of these parking spaces, even the handicap, because it isn't quite like it was before, at least for right now. We have our 3 spots still, and then wherever you park, and you'll see some closer parking spots along the way. On the windows, we have some arrows that will point you in the right direction. We also have obviously the physical therapy sign that will arrow. There is a step up here, so people that have a hard time or just can't do the steps at this point, there's some other additional parking spots. And then pretty much because we have really good weather, we're going to leave the door open so it's a no touch. I mean, you don't really have to touch anything except the ground you're walking on to get in here, so the door will be open. Then you'll come down the hallway, and if you haven't been here before, we'll bypass the first 2 doors that you'll walk past. Yes, they are open to allow a no touch way entry into our facility. And we'll have there's a lot less chairs. There's chairs out in the hallway, or people can space out. There's really a no waiting policy, but obviously sometimes if we're just a little bit of a backup or we're finishing up working with somebody, there's ample space to be away from people, a minimum 6 feet. And then what we'll do is we'll just come back here and share a few more things. So we wanted to share our new entrance way with everyone and a few other notes that we are handling this COVID-19 handling for PT offices. This is all laminated so we can wipe it down. We're wearing masks. We'll allow you to wear masks. We'll have supplies. If you don't have your own mask, at least have like a makeshift temporary one for that day that you can keep. And we will screen you over the phone. So when you call, if you haven't been here, we have a nice activation system, meaning we'll spend lots of time getting to know you and your story, why you're coming, what you want to get out of this. We don't want you to just be our 9 o'clock knee patient like you are at other places. We want you to be, Sally that has a back problem that wants to get back to lifting her grandchildren and have less pain and enjoy life better. So we want to get to know you better. Along with that activation, there'll be questions there. Have you traveled? Most people haven't, but we'll still ask you that. Do you have any symptoms of COVID? A cough, sore throat, even any nausea, a temperature, which is a big one. That's over the phone. Then when you come here, you'll get screened again because we want to take every precaution. We have our gel, over 60% alcohol that you can wipe off with. Obviously, we have our soap and water that you can wash your hands. We have gloves available as needed as well. You can bring your own, of course. You can also wear your mask in. We'll be wearing masks and gloves. We'll keep our distance, 6 feet or more. A lot of stuff we do, we don't have to be that close. And that's why our virtual visits or video visits that we're doing, some people know it as telehealth, that's been part of what we're also branching off into. So if you don't want to come to the clinic, we do have that option where you can do a video visit. But we're noticing a little uptrend now into the 7th week that we're seeing a couple more people We're still at every 45 minutes to an hour, one-on-one with you. So again, it's well spaced. You saw how you came in. You don't have to really touch anybody. You barely have to even see anybody. And you'll work with your individual therapist at that time. We will wash our hands before and after. We have our spray bottles and our wipes, which will wipe down any surface that you may touch or sit on. And again, taking every precaution. Just want to make sure we got everything here. So we have what you'll do before you arrive, upon arrival, what you're going to do while in the office, and then some other of our practice management strategies along the way. We just wanted to share this with everyone, that things, obviously the world has changed, so we're changing with it now and into the future. We will continue to check people's temperature. We'll probably add on oxygen saturation, heart rate, blood pressure checks, which is a great thing to do no matter what. And we'll be wearing a lot of protective gear in the future. So we want to share this, that we are open. We have been the whole time, just at a very low level, but now we're starting to ramp back up, and maybe by the end of the year we'll be at 85 to 100% of where we were prior to all this in early March and February. If you have any questions, like always, please email us or call. We used to say stop in. You can do that, but for obvious reasons, phone calls and emails have become a lot more popular to answer any additional questions we didn't address with this video. So we look forward to seeing you guys again. We'll continue to call. If we haven't gotten to you yet, you can always give us a call. We'd love to know how you're doing. We'll continue to send out emails like this to keep you in the loop.